Hi, I'm Dr. Sian Cole and I'm going to do a video on a typical work day for me. I am a psychologist that works on wards of acute major medical hospital and yeah, I'll show you how my day goes. So I have arrived at my office. It's about 7:45, so I'm just going to get ready and have my coffee before anyone else gets here, because otherwise in shed offices we've got to wear N95 masks, so it's really hard to drink fluids when you're wearing an N95. So I get in pretty early so I can check my emails and my referrals and try and plan out a little bit of my day. Every day is different. I never really know how many patients I will be seeing and you know who's still in or how many new referrals I've got. So my current role is seeing inpatients, but I'm also part of the COVID psychosocial response team. So that is seeing patients, well, not seeing them, we call them because we don't go to the COVID wards, but speaking to them and offering them support. And that involves social work, pastoral care and psychology. So social work and pastoral care can do some community support as well, but I tend to focus on helping people who are on the wards and dealing with symptoms as well. So with my medical inpatient role, I'm mostly assisting people with mood or motivation problems that are impacting their participation, but also helping patients with adjustment to illness, pain and adherence to treatments. Alright, well it's time for me to put my masks on, so I thought you guys might be interested to see how we do this. So first off, I actually have a surgical cap to wear because this actually helps with some of the pressure injuries around my face from wearing the N95, and just kind of helps me keep clean, I guess, and my hair out of my face, even though it's quite short now because I got my hair cut. Alright, so there's that. Now I've got my mask. So I've been fit tested, so I've learned how to put these on and know that this will fit my face as well. So this is how I put it on. Alright, squish it down tightly over my nose. Make sure it's under my chin. Do a bit of a breathe test. Yep, can't feel any draft. So there we go. Put my glasses back on. This is what I have to wear when I'm sitting in a share office. And when I go to the wards, I have my shield on as well. So that's what I've been wearing for a few months now, and you can hear it's a bit hard for people to hear me, but this is why we might get a sore throat at the end of the day from kind of yelling through all of this stuff, but again, much better than having COVID. So some of you might notice that I do wear scrubs. I've been wearing scrubs for yeah, probably close to 2 years with the pandemic, because wearing PPE can definitely make you quite sweaty, especially when you're wearing the gowns. But also just being able to just not worry about spreading COVID around. I can just chuck my clothes straight into a hot wash. And I'm not worried about it getting wrecked or anything like that as well. So, and the added bonus of scrubs is they're super comfortable and have lots of pockets. Alright, well I've just gone through my referrals. Looks like I've got 2 new referrals and a few follow-ups to do. Just to kind of give an example of my referrals. One of my referrals is a 63-year-old male who is 2 weeks into his infection with COVID. He's been intubated in ICU 4 times and he's currently out of ICU, but he's been having low motivation and engagement in physiotherapy, and he's at actually high risk of being readmitted to ICU if he doesn't engage. So the referral was just wondering if some health psychology strategies would benefit the patient. You know, we want to try and help them, motivate them to do what they need to do to look after their health, especially so they don't go back to ICU. I've got another new referral as well, but there's no referral reason given. So this happens to me sometimes. I've got to go and do a file review and see what's happening for the patient, and just really start quite open to see what is happening for these patients, so I can help them. And look, I actually know this patient. I've been referred to him, or he's been referred to me a couple of times, and that's what happens when you've been at a place for a while. You do get to know some of the patients over time. So I tend to see two to three patients in the morning, and 2 or 3 again in the afternoon, depending on meetings. I do have an ICU allied health meeting this afternoon, so I've got to make sure I can have some time to attend that. And other meetings that I have seniors meetings or providing supervision, so I just got to be flexible around what I actually do. But it's nearly 9 o'clock, and I better get ready and start getting my get ready for the day so I can start seeing patients. Okay, well, I've just got back off the ward, so I'll tell you a little bit about what's happened in my morning. So I saw one patient, a new patient for an assessment. He was actually the one that was already known to me, and found out that he had a fall at home and had hit his head. So he's starting to come to realization that he needs assistance at home or to go to a nursing home. So we're discussing that acceptance of doing that, because it is quite difficult, and also to do a referral to social work to kind of see if they can help out his family and himself, kind of get ready to do all the paperwork and everything that's needed to transition from home to care. I saw a follow-up patient as well. Look, I'm about to page the doctors because I'm a bit concerned. This patient's been in hospital for a really long time, and they're really struggling with getting some feeds into him. And I just think there's a bit of lack of communication, and so I'm just hoping that we can get the team on board and help communicate what's actually happening for him. Also booked an interpreter, so I've got a new assessment to do this afternoon with the interpreter, and that's one of my post-ICU, post-COVID patients. And I also did a phone consultation. One of the allied health team called me about a patient who has recently had a below knee amputation, and he's a bit delirious, and they just wanted to know if there's any tips or tricks in regards to help managing the distress along with that. And then once that delirium resolves, then I'll be involved a little bit more. So been a pretty busy morning, and I'll go and do that page. All right, well, it's about 3:30 in the afternoon now. I've had another pretty busy afternoon, but that's much of how my days are. So I gave a phone call to one of my post-COVID patients just to kind of see how they're going and how they're tracking with returning to wellness. And we do find people do need to take the time, and she really found my video on pacing to be really helpful for her, and not to kind of get into that boom bust and overwork it as well, and then crash and not be able to do much. So her just kind of pacing, doing her exercises has been really helpful for her. Also, I saw another patient who was post-ICU, and unfortunately he's still a little bit confused, so just not much I could really do there except for them to just kind of look a bit into like if he's got post-ICU syndrome, bit of delirium, or another infection as well. So I've had to close that referral, and they can get back to me when he's less confused. So really hard for me to do anything if people don't know who I am or remember what I say or where they are. My final patient today was a 22-year-old who I've been seeing. He had a really smashed up ankle, and so been just kind of helping him get through a number of surgeries, and just doing some more general support on the wards for a variety of different things. And then I've just finished off attending online the Allied Health ICU meeting. We've got still a number of people on the ICU ward with COVID, and some of them tend to be in for a long time, so we have to talk about them getting trackies and things like that as well. So I'm not seeing people on ICU at the moment because it is a red zone, but it's really helpful for me to attend these meetings and track patients, because I do tend to see a few of them post ICU, so I know what they've been through and can give them some support. So now I just get to do my stats and check my emails and do any of my paperwork, and then I should be able to start to pack up and go home. While the room's empty and I'm a bit thirsty, I was going to take my mask off so you guys can see what these masks kind of do to you. But again, much better than getting COVID, I must say. So, oh, not the best look. But yeah, this is my face after wearing one of these masks all day. Alright, thanks. Alright, so I've got to the end of the day and I'm in my car ready to drive home, and I was just thinking about, like, what do I like so much about actually being an inpatient psychologist? Because it's not a usual role for a lot of psychologists. Mostly they work in private practice. But I've always done a bit of inpatient psychology during my doctorate, and then since finishing that over 10 years ago, close to 13 years ago. And I really enjoy inpatient psychology. Not only do I get to work with some marvellous people and great teams, work with doctors, nurses, allied health, but I also get to help people who are very, dealing with a vulnerable, challenging time, and so being able to give them skills and strategies to get through, to help with communication and advocacy. I really do get to help people get through a really challenging and tough time, and that gives me a lot of fulfillment. So it is, you can have some really tough days for sure, and you can be dealing with lots of emotions and challenging situations as healthcare workers. I think people really know about the challenges of being a healthcare worker, especially through this pandemic. But it can be just challenging anyway, even when there's not a pandemic. So it's fast-paced, it's busy, it's noisy, but you get to work with some really wonderful people and help some really wonderful people too. So thanks for watching.